Recording in progress.
Good to see so many people here. Still people joining. All right, I'm gonna get started now. So good afternoon, everyone. I'm Nikki Blunier with IPM Institute's Pest Defense for Healthy Schools. On today's call, we will hear from Hillary Peterson, IPM specialist in the Maine Department of Agriculture, Conservation, and Forestry. Funding for this working group is provided by the USDA National Institute of Food and Agriculture Crop Protection and Pest Management Program through the North Central IPM Center. Thank you to the National Education Association, Pest Boss, and Excluder. Excluder sells many rodent and pest exclusion products and shares pest exclusion tips for our monthly newsletters. Pest Boss has software for pest control operators to track pest management practices and have helped pest defense with website updates. And the National Education Association sponsors Pest Defense's free educational school IPM webinars and workshops. Our online training modules are free and open access. Please share with any school districts you think might be interested. And feel free to contact me if you want to receive our future newsletters or join the working group. My email is nblunier@ipminstitute.org. And before the webinar, I wanted to use this time for working group updates. We're putting together a proposal for the 25-26 funding period, and we'll be asking for letters of support from our collaborators. If you're interested in supporting, please let me know in the chat, and we will reach out to you with this request formally via email as well. And we can provide you with a template letter to fill out in return. Everyone, we'd like to hear your thoughts and ideas. If you have any other updates, feel free to mention them now. Okay. Please fill out our survey to let us know which topics you're interested in for future presentations and to let us know how we're doing. We'll start the presentation in just a moment. First, I'm going to start a poll. And it should be launched. It's okay if you don't know the answer. We will ask again at the end of the presentation. So I'll just give it a minute. Okay, great. So feel free to put questions in the chat during the presentation and we'll address them at the end. So Hillary, you can go ahead and get started.
Great. Okay. Let's see here. All right. Can you see that okay? Mm-hmm. Okay, great. Well, thank you so much, everybody, for taking the time to be here today. My name is Hillary Peterson. I'm the Integrated Pest Management Specialist, so I'm in the Maine Department of Agriculture, Conservation, and Forestry, and then within that, I'm in the plant health programs. And while a lot of my role does have to do with plants, I do a lot with structural pests too. Obviously, we'll be talking about schools today. I really appreciate the invite to come give this presentation. So something I like to do with all of my presentations is use them as a jumping point kind of resource for anybody to kind of take the PDF and click the links that I've provided to learn more. So you can take a photo of this slide or click the link from the QR from your phone, and that will bring you to a PDF version of this presentation. And then in all of my talks, let me get my little laser pointer going here. In all the talks I give, the bottom right-hand corner will have lots of links to other fact sheets and where I got my information. So a lot of my talks are sharing some information, but also as a place for you to gather more fact sheets and things like that. So I'm assuming most people here know what integrated pest management is, but it's one of those things that can have so many different definitions. But one I like to use when I'm talking about school IPM is that it's an environmentally sound approach to managing pests such as insects, weeds, plant pathogens, wildlife in our communities, in our homes, in our schools. And it's this never-ending cycle that relies on proper identification, monitoring, and combinations of pest avoidance and management strategies to protect us. So you need to know what you have and what to prevent and monitor and then control, take an action, really take a step back and think and see if that action worked by evaluating that. And again, that cycle just keeps going on. The main school IPM program is really something special. And this photo here is Kathy Murray. She had my position for, I think, somewhere between 20 and 25 years. And she really started this program in the state of Maine. So I actually called her up to talk about the history a little bit to make this slide. So about 25 years ago, she had a constituent approach her who was really concerned about the pesticide use in schools. And so she did a lot of work, she did a lot of surveys, and she determined that rulemaking really was needed for pesticide applications in schools, but also storage, lots of other factors. And so she worked closely with the Board of Pesticides Control. I always say those are my friends down the hall. That's another program that's fantastic here in the state of Maine. And they worked really hard to develop rules using consensus-based rulemaking, really working hard to balance the risk of pests with pesticide misuse in schools. So finding that area where you're controlling pests, but doing your best to reduce the amount of pesticides used. And so in 2003, the Chapter 27 rule became effective, which was it is the standards for pesticide applications and public notifications in schools. I have a link to that there. And this rule is establishing procedures and standards for applying pesticides in school buildings and on school grounds. Lots of detailed information there. And something I do every year is educate school IPM coordinators about this rule. We'll go on to that a little bit anyways. So in the state of Maine, essentially all kindergarten through 12 schools, public, private, all of them, are required to adopt an IPM policy, appoint an IPM coordinator, which is typically someone on the facilities staff, but sometimes outside of that too, notify parents and staff, and post signs before most pesticide applications. We have some very clear exemptions that are taught to everybody and in this rule, and use integrated pest management to prevent and manage pests. And they need to show us that they do. We give them a really good system to do that. So schools are required to use pesticides only as part of a full comprehensive IPM approach to pest prevention and management, including monitoring and identifying pests. We have templates for schools to monitor in a systematic way, having custodial staff, teachers, students, nurses all take part in that, and ensure that those pests are identified properly. And schools need to keep pest management activity logs. They have a binder, and we have inspectors come out and look at that binder and see how things are going at the school. In schools, IPM is essential for food safety, indoor air quality, sports safety, property management. And it protects health and the buildings and the grounds and the environment, and really can save time and money. An example I always give when I'm educating the IPM coordinators about saving time and money is, what's the difference between having a good monitoring protocol on the weekly or on the daily for looking for any evidence of rodents in kitchens, or coming after a weekend or a vacation and finding rodent poop all over the kitchen. So that's a really good idea to think about when you're thinking about how it can save time and money. In Maine, these rules apply also to all schools, or they apply to all schools serving any grades K through 12. And that includes all of the buildings and structures, any attached childcare building, any school buildings, any of the portable units that are being used for students, maintenance sheds, snack shacks, concession stands, playgrounds, sports fields, gardens, agricultural fields, greenhouses, and in the state of Maine, sometimes schools will have sports fields that are actually maintained by the town. Um, and so that usually this is like ball fields managed by towns and nonprofit organizations. So if students are primarily using this, then it has to, the school IPM program also applies to that. And so I'm sure many of us know here, pests can pose a lot of risks to people. Mice, cockroaches, and mold can really influence folks with asthma and allergies. Lice, bed bugs, mosquitoes, ticks, bees, wasps. Here in Maine, we have brown tail moth, which is a caterpillar that the hair gives you something kind of like a poison ivy rash. Bats, ticks, mosquitoes, rodents can spread infectious disease. And of course, poison ivy can also be an irritant. And house mice alone can cause asthma complications, food poisoning, and skin rashes. It's really important to protect the kids. And so our school IPM program, something that we try really hard to do is integrated pest management into normal operations. I like this graphic I found for facility management and all of the different things that go into that. And we really try to make IPM integrated into that so it's not a separate entity for folks, so folks really understand that it's one and the same. And so I just have a couple pictures here just showing off some of the trainings that we do for our IPM coordinators here in Maine. They'll come together for like a 3 or 4 hour training. I'm happy to say that they usually seem to like it. I try to make them fun, and it's a nice networking opportunity for these facility folks to get to meet people from different schools, and we go on a tour of each school that we is our host school for the event. And it's really honestly a really great day every time we do it. I really enjoy it and getting to meet everyone. And so with the school IPM coordinator, and I promise I am getting to nurses, I had to do a big build up here. We really try to educate the IPM coordinators during those trainings that it is so important for integrated pest management to be a team effort. We recognize, especially these facilities folks, they're so busy. And so their role is really to be the captain and coordinator, but to have all these other components in the school, all these other people helping them with these IPM responsibilities. So office staff should be helping with communication, records, and scheduling, custodians with sanitation, monitoring pests and reporting problems, maintenance staff with pest exclusion and monitoring. If needed, a contracted pest service for monitoring, control, and communication. The business manager should be involved and understand that some of the budgeting really needs to go into this preventative care for the school. And of course, students, nurses, and teachers are really important for educating the students, for having sanitation and monitoring for things that are going on. And this monitoring is really what we're going to be delving deeply into today. So that IPM coordinator in the middle that I mentioned, they're really important for implementing and understanding the school's IPM policy, so coordinating pest monitoring, management, and record keeping, approving pesticide applications. This is a big one. We have a sheet that they go through whenever a pesticide application has to happen in the school that guides them for the different steps and things they need to think about and show us what the pest is. Document that all notification and record keeping requirements are met. And to be the communication hub in the center there with staffs, parents, and contractors. And so going back to this chart, communication is so key for integrated pest management to work right, especially in something as complicated as a school. And sometimes in Maine, we'll have one integrated pest management coordinator for a school district that has 8 or 9 different schools. And so they have so many different things to think about. And so when I was working on this presentation, I really started thinking, the nurse is such a central hub for communication with what's going on with the health of the students. And the nurse is oftentimes who is actually communicating to the parents and hearing back from the parents about student health. And so I sort of tried to make an arrow chart here showing that the nurse talks to the parents and the nurse talks to the office staff, and the nurse, if he or she is seeing lots of different issues going on, should be reporting to the custodians and the IPM coordinator. And it's just such an important role. And on top of that, something that the IPM coordinators expressed to me a lot is that they struggle having the budget that they need to really properly do integrated pest management in the schools, especially with a lot of the prevention, doing building repairs and things like that. And so I think that the nurse is crucial in communicating the importance of this health to the business manager when they're talking about contracts and budgeting. And as I was working on this presentation, I found this sort of two-pager. Again, I have the links in the lower corner here that just had, it was all based in semi-recent research and just had some really great quotes that I feel like could really help maybe a nurse in a scenario when they're talking to the business manager. I have two quotes here. The first, in schools with IPM programs, 14% of dust samples had detectable pest allergens compared to 44% of dust samples from schools with conventional pest management programs. And then the other quote, a study conducted by Boston Children's Hospital found that mouse allergens were detectable on desktop surfaces in 100% of sampled urban preschools and 95% of sampled urban elementary schools. So I just think that these quotes are really powerful. And so here in Maine, something that Kathy put and other folks put together is so fantastic. It was last revised in 2017, is our school toolkit, which can be found on our website, which is maine.gov/schoolIPM. I also have a link here in the corner to it. And what I really love about this toolkit is they designed it to be able to be printed out or just divided on the computer and split up into checklists for all those different team players I was talking about in the school. So we have a turf manager's checklist, food service checklist, office staff checklist. And today we're going to be talking about the school nurse and health coordinator checklist. And so this is that school nurse checklist. And so what I thought would be really nice for this presentation today is I took each of these points on here. Obviously, they're too small to read right here. Maybe some people, if you have a big screen, you can. And I split them out into their own slides. So each point is going to be a slide for the rest of this talk. And we're going to delve more deeply into why and how those check marks are there and how important the nurses are. So the first checkpoint is school nurse is a member of the school's environmental safety, integrated pest management, and indoor air quality teams. And I put in parentheses, ideally. When I finished up this presentation, I had a chat with Emily Poland, who's our school nurse coordinator here at the Department of Education in Maine, just to kind of ask, like, do all schools have indoor air quality teams? And they don't, but there should always be some kind of environmental team or safety team. And the school nurse absolutely should be a member of this team because they are so crucial in communicating what's going on with students and what needs to be going on for safety. So for example, schools nurses should be able to recognize and report on increases in asthma-related incidents and illnesses, any food poisoning incidents, increases being seen in tick and mosquito bites, any sports injuries. They also could and should be advocating for IPM policies and practices that are going to reduce rodent and cockroach presence in schools, such as food being stored in sealed pest-proof containers, garbage being cleared and stored properly daily, and safe cleaning practices when rodents are captured. The school nurse, another check mark here, was they really should be knowledgeable about potential impacts of pests and pesticides on human health and be involved in the decisions regarding selection of those pesticides and cleaning products. I mentioned here safe cleaning practices when rodents are captured. The CDC, I have this link down here, has this fantastic page with a bunch of these infographics on how to clean up a dead mouse. It might seem simple, but it really is not, because if done improperly, airborne pathogens can just be like poofed into the air. And that's definitely not great. And so this is a great guidance document that really teaches you how to prevent that, wearing gloves, soaking with the bleach and water solution for 5 minutes, and then putting that into a bag that then gets thrown into the trash. Just something important to think about. And some of these statistics that school nurses can think about and present on in these scenarios, this one here from the NIH Because of poorly controlled asthma, each year about 4 in 9 children miss school, 1 in 3 adults miss work, and 7 in 13 adults also limit their activities. And for anyone out there that's a parent, I have a 2.5-year-old, and this missing work from the illness from school can get rough sometimes. So anything to prevent that for especially kids with asthma, it's really important to think about these things. I also found this really great Harvard School of Public Health Healthy Buildings Guide. And they have a lot of work done on the 9 foundations of a healthy building. So all these important factors to think about, with dust and pests just being one of them, but also safety and security, water quality, noise, lighting and views, ventilation, air quality, thermal health, and moisture. There's so many things to think about for keeping kids healthy in schools. The next check mark, is that the school nurse should be involved in decisions, policies, and procedures regarding furred and feathered pets in classrooms. So, this is really important policy for schools to develop, because children with asthma and allergies really need to be considered in these scenarios. Animals can subject students to scratches, bites, and infections. Policies typically should include rules like making sure that any animals are updated on vaccinations, having animal cages away from ventilation systems and away from furniture or stuffed objects that their fur or dander might get on, and developing protocols ahead of time on what happens if an animal does injure a student. Some scenarios to consider: classroom pets for education are really popular. Pets from families being brought to sporting events, making sure to have rules in place about that. Any scientific experiments for kids in, later on in high school, like dissections, and if animal eggs are going to be dissected. Therapy animals coming into school is getting more popular, and of course, service animals too. So I looked around online and I found a few different example school policies here in Maine and what those look like. So if your school doesn't have this in place, it's definitely something important to think about. The next check is that school nurse has access to safety data sheets for all pesticides, disinfectants, and sanitizers used on a school property. So this is so important when cleaning is going on, that the nurse has access to these in case anything happens, of course, to be able to have quick access to the first aid information and to know what to look out for if students are coming in with any suspicious symptoms. And of course, the same goes for any pesticides, disinfectants, and sanitizers. And if you don't know this, something as seemingly innocent as a Lysol wipe is a pesticide. And any pesticide is going to have a label, and the label is the law. And there's really important information on these labels. This says may cause eye irritation, avoid contact with eyes, wash hands after use. Store unopened in a cool, dry place, inaccessible to small children. Children should not apply disinfectants in the classroom, including disinfectant cleaning wipes. All disinfectant labels include the statement, keep out of reach of children, as children are considered a sensitive population. And I bring this up because I actually know someone who has lifelong eczema on their hands, because when they were growing up, their schools were having them clean their desks with these types of Lysol wipes. And so they are really important things to think about. And again, something for a school nurse to know, that if a student is coming in and it's like a mystery why their hands are having issues, to know these things and know what's being used to clean around the school, that might help help the nurse figure out what's going on. It's also so important on that same note that school nurses can recognize signs and symptoms of pesticide exposure. Some commonly used pesticides in schools here in Maine include disinfectants, ant baits, rodent bait stations, herbicides for weeds, and mosquito and tick treatments. And while we have a lot of rules in place, and we're hoping to always be preventing any kind of tragedy, in case something happens and say somebody goes out and decides to buy something at a big box store like this bait here, the nurse really needs to know what the signs and symptoms of pesticide poisoning are. This is a chart from the American Academy of Pediatrics. I have a link here. And some of the symptoms can include, depending on the pesticide, bleeding from the gums, nose, and other mucous membrane sites, central nervous system symptoms such as respiratory depression, lethargy, coma, and seizures, sweating, salivation, lacrimation, diarrhea, and disorientation, severe agitation, drowsiness, dizziness, weakness, and sometimes loss of consciousness. So these are really scary things to think about, but it's so important to be able to recognize these signs and symptoms. Another great resource you really should consider downloading. It's so good that I gave it its own whole slide with a QR code for just this as well. This recognition and management of pesticide programs, pesticide poisonings put out by the EPA. So I'll just leave this up for a second in case anyone's taking a picture of this slide. So the next check mark is that school nurse understands and educates students, staff, and families that insect and spider bites alone are insufficient to identify a pest. Rather, a specimen of the suspected pest must be collected to obtain an accurate identification. And I saw 100% of you answer the poll correctly. Maybe it was too easy of a question, but I think it's something really important to think about because I get calls a lot, people calling and they thought that they saw something in their house. And so they went to the big box store and bought a pesticide that you're supposed to spray on their lawn and they sprayed it all over their bed. It's really important that people understand that just a mark on your skin is not enough. You have to know what bit you to even know if it was an insect or if something else is bothering your skin. And, insect, tick, and spider bites can look really similar. And even within species, for example, Lyme disease, this nice little Lyme disease educational social media thing I pulled off the Maine CDC site. They can differ person to person. Here in Maine, I give out at the school nurse conference every year this amazing poster. It's huge. It's amazing, but kind of gross to look at, with a bunch of different pictures of different bodies reacting to Lyme disease bites and different skin tones, and it can really differ person to person. And so it's really important when you can to have a specimen, considering creating some protocols for what that specimen collection might look like is really important. So, I'll talk about a specific one for ticks later, but if a student gets bitten by an insect outside and you say it's like an ant mound and teachers are able to at least know where it is so you can go back and look, it's really important. And so some of the communication steps specifically that school nurses can do to help with school IPM, when talking to parents, educating parents to reduce that spread of misinformation, making sure that parents understand that you can't identify just from a bite alone. When talking to facilities staff, ensuring that communication is happening when biting and stinging insects are found. So either if a nurse sees all of a sudden a bunch of students coming in with stings, letting facilities know that they need to figure out where that nest is, or vice versa. If the facility staff found a nest and they're going to be dealing with it, letting the nurse know that they found that nest. That open communication is so important. And then finally, with teachers, nurses should educate teachers that when possible to collect, like if they see a biting insect, maybe not going and like collecting it, but at least letting them know where it is or taking a picture of it. So the nurse gets some more information so he or she knows what to do with that bite. The next point, school nurse understands and educates staff, students, and families appropriate personal hygiene and facility sanitation measures to help prevent or reduce the spread of pests such as bed bugs. So broadly, it's important to say that actual in-school infestations of bed bugs are extremely uncommon. Bed bugs need to feed and come out at night. And so the probability of them coming into the school and having an in-school infestation is not very common. What can happen, though, is that bed bugs do have the potential to spread from one student's belongings to another. So if they're on a backpack and all the backpacks are hung up, kind of shoved together as they often are, that's how they can spread. And so it's super strongly recommended when we're talking about bed bugs to have policies in place ahead of time for response and communication, because once a bed bug is found, a lot of people tend to panic. Just to from sort of my position in the state, I've had a situation where a bed bug was found at a school and there really wasn't a good policy in place. And because of it, parents were talking about it a lot and calling me a lot. And I had a lot of parents telling me the name of the kid that had the bed bug, was suspected to have the bed bug. And I felt so terrible for this kid. I feel like this kid knows that all the other kids know, and they're probably going to be bullied as the bed bug kid forever. And that makes me so sad to think about. And so this is something that really needs to be handled discreetly and with caution and care. There's a lot of great resources out there with template policies. We have some in Maine. Just copy, paste, and change the name of your school. Some of the communication steps specifically that school nurses can help with parents, when something happens, when a bed bug is found, use caution when sharing information with parents. It's really, as I said, best to have a pre-made letter for these situations and avoid the name of the child that has the bed bugs. For facilities staff, working with a hired pest professional to inspect with a thorough cleaning conducted. And teachers, making sure teachers know protocols and to be super discreet when handling these situations. All right, now we're going into head lice. This one made me a little itchy. So lice are actually most likely to spread from head to head. And I was thinking about this and wondering how head-to-head contact happens. But again, I have a 2.5-year-old, and I think about when I see him playing with his friends and they're all rolling around, and it can happen. They also can spread through clothes, hats, combs, things like that. It's a little bit less likely, but probably definitely best practices to avoid that. One important thing to know is that personal hygiene is not a factor for infestation. Again, just like with the bed bugs, it's really important to have a lot of discretion in these scenarios because there's a lot of myths out there about things like personal hygiene. And if the student is sort of found out as the student that had head lice, that could have a lot of implications for maybe they're going to be bullied or viewed a certain way. And most policies recommend these days that students can return to class for the remainder of the day, go home, have treatment, and then come back. So some important communication steps with head lice for school nurses. For parents, making sure to inform parents of those schools' protocols and provide instructions for home care. For facility staff, maintaining records with each incident that happened, including the classroom, to stay calm and do not apply pesticides to classroom or buses in these scenarios. It's not needed. For teachers, ensuring that teachers know protocols if lice are suspected, include waiting for the school nurse to actually diagnosing lice and maintaining confidentiality. So lice are a specific scenario where parents will likely be instructed to use a pesticide at home. So we're going to dive a little bit into that pesticide safety here, starting with school nurse emphasizes to parents the importance of reading and following the instructions on lice control products if a parent chooses to use these products. So I always have this picture on any slide where I emphasize the label is the law. When it comes to head lice, DIY solutions are really not recommended. Parents should avoid DIY solutions, do-it-yourself solutions like mayonnaise, or some of the homeopathic shampoos may not be as likely to work or help at all. Labels will very important to read the label because they'll indicate proper age and instructions for safety. This is a little screenshot of a chart from I think it was Michigan, had this excellent, like, I think 20-page amazing overview of all the different pediculicides, it's a hard word to say. Those are pesticides for head lice. Excellent overview in that document with a table describing each, what age they can be used for, things like that. Some of the common pediculicides may contain permethrin, pyrethrins, malathion, benzyl alcohol lotion, ivermectin lotion, and spinosad suspension. Going a little deeper into reading the label first, this is a screen grab of a label for one company. This doesn't constitute an endorsement of this one in particular, just was the first one that came up on Google. And I just have some screen grabs to show you some of the pieces of the label that can be really helpful. And, if students are going to be going home, you can let them know or even help depending on, what you're able to do, printing out this label, because it's going to come in the box all folded up and tiny, but you can get a nice big PDF of any of these labels on the company websites and print them out so they're easier to read and maybe review with the parents. But from this label, here's just an example. They have precautions. Care should be taken to avoid contact with the eyes. Do not use if the scalp is already irritated or injured. Do not use for longer than directed, 10 minutes. Not for use by people with sensitivity to mineral oil, intended for head lice, not pubic lice, and not for children under 12 months. Super important information. And these labels also are going to have really specific instructions on how to use the product properly. With pesticides, again, the label is the law. So of course you need to be using it properly, but in many situations, if you don't follow the label, it's not going to work. And in some instances, it can actually make things worse over time. Improper use of pesticides can lead to more cases of insect resistance. So just super important to follow those instructions. You'll see down here, it says to check hair after 7 days. If lice or nits are present, repeat steps 1 through 3. And so school nurses also should definitely in these situations explain that using this shampoo does have, or whatever these other products, sometimes they're shampoos or lotions, but explain that they have limitations and what those limitations are. So for example, you don't want to be using these unless there is absolute 100% evidence of head lice. Do not use them as a preventative measure. Using this product is not going to prevent head lice from happening on a child, and you're going to be needlessly exposing your child to pesticides, which is not a good idea. It's really important to combine the use with manual removal for best results. And oftentimes a second treatment may be needed, especially if the lice nits, the eggs, were not removed in between. When using pesticides, they have an intended life stage that they're going to do best against. And so I have sort of an enlarged drawing of a louse egg here. And you can think of insect eggs like a shield. And oftentimes that shield is impenetrable by many pesticides. And so if you use the shampoo and there's a bunch of eggs and you don't remove them, those eggs are going to most likely survive the shampoo treatment. So then they'll hatch and then you'll have them again. So you'll have to hit them again. That's why this says to check hair after 7 days. These are very well calculated to work as long as the label is followed. So the next checkpoint, school nurse understands and educates staff, students, and families to appropriate personal hygiene and facility sanitation measures to help prevent or reduce the spreads of pests such as scabies mites. So scabies mites are transmitted person to person through direct contact. Children may complain of being bitten, or there could even be evidence of bites on their body, and they're diagnosed by microscopic examination of skin scrapings. There are some important communication steps for school nurses, including students need to leave school and can come back the day after treatment. I say, again, I have in parentheses, be gentle, be discreet, be cautious about these situations. The facilities staff should be notified that carpeted areas and tiled floors need to be cleaned where that student was present. And then teachers should ensure that clothing, towels, and bedding are not shared between students as much as possible. School nurse understands and educates staff, students, and families to appropriate personal hygiene and sanitation measures to prevent or reduce the spread of pests such as ringworm. Ringworm has a kind of silly name because it's not a worm. It's actually a fungal infection of the skin. And it's similar to bed bugs and lice, where children can return once they begin their treatment. So with parents, it's important for nurses to provide guidance to prevent the spread, such as wearing shoes in school showers. For facilities staff, it's important that if ringworm is being seen in students, that they know and make sure that they look at their locker room cleaning protocols and make sure that they're following what needs to be followed to prevent this. And teachers and also coaches should teach children not to share bike helmets, hats, anything that touches their skin, not to walk barefoot in areas like locker rooms or public showers. And athletes that are involved in close contact short sports should shower immediately after a session or match, keeping all of their sports gear clean. It's important that the school nurse maintains school policies and procedures addressing the use of insect repellents on school grounds. I am always telling everybody about this amazing EPA repellent search tool. I absolutely love it. You can put in how much time you're going to need to be protected from biting insects, mosquitoes, ticks, or both. And then you can refine it a little further, like if there's a specific company or active ingredient. And it will spit out this amazing table that shows you a comparison of all the different products that you can use and how long what ages you can use them on, how many applications you'll need over time. So it really helps you make an informed decision about repellents. And so, overall, schools should really adopt a repellent use policy and review that annually, and also review it in any case when the school is notified of a mosquito-borne disease threat. For parents, if schools opt in for a written parental consent policy for repellents, school nurses should ensure that parents fill this out and those records are kept. And also parents could be encouraged to apply repellents before school if students are going to be going early in the morning and playing out on the playground. Mosquitoes are really active at dawn and dusk, so making sure that students are protected during that time of the day. And if teachers are going to be responsible for applying repellents to students, nurses should really work with the teachers to make sure they're trained in how to do that properly. So delving a little bit into our biting friends, the mosquitoes, the school nurse should be knowledgeable and communicate with students and staff appropriate measures to prevent or reduce encounters with pests of health concerns such as mosquitoes. So mosquitoes can vector some really serious diseases, including Eastern equine encephalitis, West Nile virus, and Zika virus, and many more. They can breed in shallow water, including bottle caps, pots, garbage cans, and tarps. And when you're thinking about a school and a playground, it's really likely that there are lots of little places for the mosquitoes to lay eggs in water. You might have some overturned, what are those called? Cones, the orange cones, overturned like orange driveway cones, traffic cones. Took me a minute to get to that, sorry. Playground equipment might have water pooling inside, so drilling out holes so that the water is able to drain. And nurses can also use pre-made curriculum to educate students. So here in Maine, I have this cute little bingo card from the Maine CDC mosquito curriculum. It's all free, it's all online, you can print it out, it's separated by age. And so some of the communication steps that school nurses can take with mosquitoes include educating parents about the importance of students wearing protective clothing, including the clothing being light colored with long sleeves, long pants, and the pants tucked into the taller socks. That's here on this little bingo card. I know it's not fashionable, but it's great to not get ticks and mosquitoes. The facilities staff should be notified if children are presenting with more frequent mosquito bites. There may be some needed habitat modification, as I said, trying to see if that water is pooling anywhere, and maybe even a discussion about if the populations are really high and there's some disease going on, not having students outside at dawn and dusk, which can be tricky, but important to think about. And then teachers can educate students about nurses can talk to teachers if they're outside at recess with the students. If they see playground equipment with pooling water, just tipping it over, being on the lookout for things that the facilities staff could do to help, and being on the lookout for students just complaining of a bunch of mosquito bites. I think if students are getting bitten a lot, they'll probably say something. And same goes for ticks. So ticks, of course, can also vector diseases, including Rocky Mountain spotted fever, Lyme disease, babesiosis, and Powassan encephalitis. Just as with mosquitoes, there are habitat modification steps that can help reduce the number of ticks. There's some great guides we have on our website from the Connecticut guide that shows you, if you're designing a new playground, how to keep things, keep ticks away, any sort of measures to keep students away from the edge of the woods, moving playground equipment. If fences are able to be put up to keep deer and other animals from coming onto the playground, all of these measures can help reduce the ticks. And considering a policy on what to do with removed ticks. So if students have ticks, it's really important, especially if it's a deer tick or black-legged tick, to remove that tick and have it available to bring to the doctor in many scenarios. So just thinking about what would work for you in your school. I went onto the Maine website, the Maine Tick Lab we have up at the University of Maine, and what they want you to do when you send ticks in is essentially to put them in Ziploc bag and then put that in an envelope. So you could choose to see what your state has for submission and figure out a protocol that works for you. And some of the communication steps here, school nurses could talk to parents. Again, just like the other slide, educating about the importance of students wearing protective clothing, a discussion about repellents. Facility staff should be notified if nurses are seeing an increase in tick encounters, maybe some habitat modification or other treatments may be needed. And teachers can educate about helping students to avoid that tick habitat and perform self-checks on clothing before returning back to the classroom. School nurse is knowledgeable about and communicates with students and staff, all about stinging insects. So, oftentimes yellow jackets are going to be posing the greatest risk to students getting stung if their nests are essentially intersecting where students are playing. And those nests can be hidden. They can be underground. They could be built inside of playground equipment, hidden inside of hollow branches or trunks of trees. And essentially, if multiple children are reporting stings within a couple of days, there's probably a nest somewhere that needs to be found. So on top of this, it's really important to monitor children when they are stung for allergic reactions. So for school nurses, it's important to talk to parents at the beginning of the year and provide any information about reactions to past stings. If anaphylactic reaction has happened before, making sure that you have protocols in place on what to do when that happens. For facilities staff, make sure that they know if the nurse is suspecting a nest and to follow up to determine if it was removed or not. And then finally, making sure that teachers are also aware of protocols for potential anaphylactic reactions, what to do. And I just have here again, a sting alone is not enough to identify the species. Just keep in mind that what might look like a sting could be a bite, it could be a mark from something else. Just investigating these scenarios and not just having the assumption that there are yellow jackets is really important. So with that, I was just going to show a couple quick pictures. This was 2 years ago at the School Nurses Conference here in Maine. This is some tabling that I do. I get some really nice handouts, some of the things that I showed, some of the posters from the presentation, and lots of great goodies from the Maine CDC. And this is my technician this summer and year, Marlis, helping me out at it this year. And with that, I'll take any questions.
Thank you so much. That was a great presentation.
Thanks.
Yeah, if anyone has questions, put them in the chat or raise your hand.
And this is the QR code again to the presentation.
Veronica, do you have a question?
Oh, yes. I was trying to figure out how to raise my hand.
Go ahead.
I worked with Kathy. First of all, that was a wonderful presentation, Hillary. You did a great job. And you have a great website, and we refer people to your website there on School IPM because you've done such a great job, especially like how you have documents in both Word and PDF so the schools can customize. So
Great,
you've got a great legacy and you're doing a great job.
Thank you. I appreciate that.
I do want to bring up something. While we were doing that project, we had grant money to do the school nurse project. And as somebody that comes from the perspective of children's environmental health, one of the things that we promoted, this is a little electric lice brush.
Oh, cool.
And it doesn't cost much at all. It takes 2C batteries. I'm sure they're updated by now. But when the kids come into school, if they just get their hair, this works on curly hair, long hair, it works on everything because of how the brushes vibrate. And simply having the kids' hair brushed, in the morning when they get to school eliminates the need for putting malathion and other things on their hair. We always cringe when we see any recommendation to put pesticides directly on children's skin. It's just not a good idea. And the IPM approach, if you simply comb their hair every day, you will eliminate all of the nits more effectively. And if you just comb their hair for 2 weeks, we always recommended for 2 weeks, you comb their hair, have them go to the nurse's office every morning on their way in and have their hair combed by the nurse, and don't require them to show proof that they had pesticides put on their heads, because we don't know how those pesticides will impact those children later in life. You talked about the life cycle of the louse and the lice when the pesticide hits them. You have the same thing with children. When you're putting the pesticide on their head, depending on where they are in their life cycle, you don't know when the impact of that pesticide will hit the kid. So I just want to say that we should probably update it and put some recommendations, like having school nurses use a thing like this that works on long hair, short hair, curly hair, every kind of hair, and is very effective. And if you comb for 2 weeks straight, you're going to make sure you got the nits out and anything that may have your 7-day cycle. You've caught 2 7-day cycles. But
Great.
everything else is just wonderful, and you're carrying on beautifully from a great person that preceded you.
Thank you. Appreciate that. And that's a great tool. I didn't know about that. And, I think it's important to have tools like that and to just make sure that parents know that, parents are going to do what they want at home. Make sure they know if they're going to use that they have to follow the label.
Right, right. And this is called a magic comb, MAGICOMB.
Awesome. I'll write that down.
Thank you.
Cool. Yeah, someone else in the chat asked that, so that's good. There's another question in here. When did IPMS become the law, and was there any pushback? How did they deal with that?
So 2003 is when that rule was published. I don't have a good history on if there was pushback. I'm not sure if Gary's here. He might be able to answer that, Gary Fish. Let's see. Let's see if he's on the list. Yeah, I don't know if there's pushback. I'd like to know the history on that, but I don't know. I will say that when I talked to Kathy about her experience, though, let me go back to the slide because I had some notes and she did have something great to say. One sec. Going way back. She said, I'm going to move some things around here so I can read my. She said that since 2003, there's been almost nothing changed to those consensus-based rules that they worked on. They got so much input, basically nothing has changed, which is a testament to how well they work and how well they were kind of accepted and they're used, because people aren't asking for things to change on it. I do know that just a few years ago in Maine, glyphosate is now not allowed to be used at schools, so that was a very specific change in the rule. There was some changes during COVID for a short period of time that folks could use those electrostatic sprayers without a pesticide applicator license, and now they need one. So little changes over time, but generally it's been pretty well accepted.
Yeah, we just have a couple comments. I don't see any more questions right now. Other states need to adopt school IPM and train their school nurses. Great presentation. Keep up the great work. Um, Interesting. Never seen this before. Thank you both so much. Does anyone else have more questions?
I have one more comment. I want to just compliment you for including the EPA guide on pesticide, Physician's Guide to Pesticide Poisoning, that blue book that you put up. I order 100 of those at a time.
Oh,
They're
nice.
free. And when we first implemented our IPM law here in Maryland, we gave all of our school nurses a copy of that book to keep in their offices. So it's a great resource. The version you have, I think, is either the 6th or the 7th and the most current. But it will show you a lot of people don't understand exactly what the impacts are of these pesticides. So even as you're trying to evaluate whether something is a low risk, yes, that's the one. Understanding what the health effects are and reading the chapter on that particular pesticide or chemical is so critical in making these decisions. So that it should be in every pesticide applicator's office, every IPM coordinator's office, and quite frankly, every nurse's office. So thank you for including that. That's a great resource and it's free.
That's good. I didn't know that it was free. I should order some. I'll give them out at the
Yes,
school nurses conference from now on.
it's free.
Someone wanted to know if you can clean that comb and then use it on someone else, or if it's just for one person.
Absolutely. The school nurse used it in our school. They're metal, stainless steel metal combs that come out and you can clean them. So you can use them repeatedly. You know, you can just clean the combs and go on to the next student.
Cool.
So it's absolutely, and they're very good because like I said, everybody was shocked at how well it worked on short hair, long curly hair, any kind of hair. And it's very thorough. And the key is to do it once a day. And we always said, not just for 7 days, do it for 2 weeks. Just
Mm.
comb the hair once a day for 2 weeks. And you'll make sure that there are no nits, you know, and no more lice in the hair.
Cool.
Thanks.
All right, great. We still have a couple minutes. Anyone has more questions for Hillary? I think that might be it.
Great. And
So,
I meant to mention, there was one thing I forgot on one slide, since we have a second.
okay.
Going back to mosquitoes. If I can find it. Here we go. I have a link here to a notification to schools that I just put out 2 weeks ago. We are having increased numbers of animals with Triple E and West Nile virus here in Maine right now. My job as the integrated pest management specialist is pretty broad. So we also have a program where we're part of sampling mosquitoes and sending them off for disease. So I talk here about, what to do if a notification goes out of disease, and just if you want to see what that looks like here in Maine, what we actually send out to the school IPM coordinators and school nurses, that link is here and you can check out what that looks like.
Okay, thank you. Marlena said, can you put the link up again to save the recorded version? What are you referring to? The recorded version of... Okay, okay, we're good.
Yeah, this QR will just give you the PDF, and you're gonna post the recorded talk online somewhere, right, Nikki?
Yes, I will
Okay,
share this with everyone who registered. Yeah, if that's
awesome.
what she
And if it's
needs.
okay
Yeah.
with you, I'll probably put this recording up on our school IPM website too.
Yeah, that's totally fine. Yeah.
Great. Cool.
So yeah, thanks everyone for joining. Thank you, Hillary. I'll put the recording up online, send it out to everyone. So have a great afternoon.
Thank you. Have a good one.
Thank you so
Thanks.
much.
Bye.
Bye.